Hello everyone! Today I will talk about the field of dermapigmentation. Most of you understand the concept of pigment or pigmentation, but what about dermapigmentation? While I know that sounds like a mouthful, it's a really simple concept. It has to do with the process of implanting pigment under the skin. And today I'm going to explain what is the dermapigmentation and how it works. So dermapigmentation is a large field that can be divided into smaller categories, and each category requires its own specialized technical knowledge. These categories are permanent makeup, microblading, scalp micropigmentation, paramedical micropigmentation, and body tattoo. First of all, let's start with permanent makeup. What is permanent makeup? Permanent makeup is created by implanting pigment on the face, most commonly on the eyebrows, lips, or eyelids. And the goal of permanent makeup is to restore and balance the natural beauty of your client. Permanent makeup is not designed to give your client a made-up look. It's designed to make your client look more beautiful, more balanced, and at the same time, very natural. Permanent makeup is also can be used to conceal or to correct certain issues of the face. It can be used as a highlighter or as a lowlighter, or to create a blush for the cheeks. Permanent makeup is applied by using permanent makeup machine. This is a specialized device that has a retractable needle. The concept of this machine is the same as a sewing machine. And what it does, it punctures the skin, making tiny little holes and leaving those holes to be filled with pigment. This machine is used along with specialized pigments designed specifically for this procedure. And I will go more in detail about those different types of pigments that exist on the market. That will be my future lessons. But for now, what I want you to know is that there are specialized pigments for each category of dermapigmentation. The next is the microblading. This technique involves the use of a manual hand tool, and it's used to implant pigment most commonly on the eyebrows. This procedure is quite different from permanent makeup because you have to manually create tiny hair-like incisions or tiny cuts that resemble the eyebrow hairs. And this procedure is not appropriate for everyone, especially if you have a client who has mature skin or very thin sun-damaged skin. Microblading can be used if you have a young client or someone with very thick skin that is full of collagen, and the skin that is not prone to scarring. For example, Asian skin. Asian skin is perfect for microblading. But still, keep in mind that microblading is not for everyone, and it can create scarring. And even if it's not a visual type of scars that you can see with your naked eye, it can definitely change the structure of the skin. And this will become your problem when your client will come back a year or 2 years later for a touch-up. It will be very difficult for you to work with that skin again. So if microblading is the only technique that you know, I highly suggest for you to consider learning other types of techniques like machine hair strokes or permanent makeup machine implantation of the pigment. And the next category is scalp micropigmentation or also called SMP. This procedure is designed to restore the appearance of natural hairline by implanting pigment under the skin on the scalp. SMP can also be used to fill in scars from the hair transplants or to create an illusion of fuller hair. This procedure is most popular among men with receding hairlines, but sometimes women get this procedure too to make their natural hair to look fuller and thicker. Paramedical tattooing is another category of dermapigmentation, and this procedure helps to restore a healthy appearance of the body. Examples would be recreating nipples after reconstructive surgery, covering vitiligo. Vitiligo is the patchy skin that lost pigmentation. Also, we would be working with hypo or hyperpigmentation. That's too much or not enough color on the skin. And also, it would be covering the scars or stretch marks. And the final and the most popular type of dermapigmentation that I'm going to talk about today is body tattooing. And probably most of you are familiar with this procedure or with this concept. It involves implanting pigment on the body for decorative purposes. Sometimes clients will express a specific intention or meaning behind the drawing, and sometimes it can be related to a concert they went to or to a name of a child or significant other. But sometimes those designs have no special meaning. It's just a design that the client admires. And I also see that some artists choose to specialize in small body tattoos. I often see that those artists who offer permanent makeup procedures also specialize in small body tattoos. To recap what I said, dermapigmentation is this large field which is basically implanting pigment under the skin. So dermapigmentation, so pigmentation under the dermis. It's this large umbrella and it has several categories. And each category has a special technique of implantation which requires its own specialized knowledge. And permanent makeup is just one category of dermapigmentation. Thank you for listening, and I will see you in the following lesson.